Welcome back. Joining us now is Rosemary Cree Medicine from Browning, the Blackfeet Tribal Health Director. Thanks for being here to discuss the work you do.
Thank you.
And I know it's very important work, and our viewers are looking forward to hearing from you.
Yeah.
So the first question is, can you give us a basic overview of your program and the tribal health programs in general?
Sure. Tribal Health is a 638 program that currently oversees 17 health programs in Browning.
And so it does this in Browning only, or is it throughout the state?
Basically on the Blackfeet Reservation is where we do all of our work and have our programs and do outreach work within the whole community. I mean, like East Glacier, Bab, Heart Butte, those outlying communities, we reach out to them as well.
So we know a bit about Indian Health Service. We've talked about that before. But can you describe the difference between the programs that you direct and the Indian Health Service, and then talk about the different types of people that are served by each?
Okay, so Tribal Health, like I said, is a 638 program, and 638 is when the tribe contracts a program from IHS, and we currently have 5. We have Tribal Health, CHR, the Crystal Creek Treatment Center, EMS, and our IHS security. And with the other programs, they're through various grants and some funding from the state, SAMHSA grants and grants from IHS. We do serve all the same people on the reservation, and the services. What's different with IHS and Tribal Health is we go after funding where they get their funding yearly, so they don't have to go out looking for funding.
That's an important distinction. So
Yeah.
you and your program go after grants and funding, whereas the Indian Health Service is federally funded.
Yeah, yeah.
So what is your background, Rosemary?
I've been in the business in the health business since 1998. I came on working with the diabetes program. Sort of worked my way up, started out as an outreach worker, then the office manager. Then I became the director, and I directed the diabetes program for 10 years. And then 2013, the Blackfeet Tribal Health position came available, and I applied, and so I've been with the Tribal Health since 2013.
So as part of your position then, do you travel across the state?
I do, yeah. Like I said, I was just in Bozeman the other day, in Helena here today. Yeah, I go out of state, in state, just all over. And a lot of times while I'm traveling, I do make connections, and we do find funding just with visiting, finding someone, letting them know what we need, and so business cards exchange, and we're finding funding, so.
What are the challenges that you face as in your role really as the Tribal Health Director?
I guess speaking for Blackfeet, just finding people qualified people to fill certain positions, and of course funding is always, like I said, we're always going after funding to help find programs to serve our people. I guess just we do have qualified people, but there's certain positions, say like a mental health specialist, a license, so just finding those folks is hard, I guess.
How many employees do you have then?
Within Tribal Health?
Yeah.
There's well over 100 with all the programs that we have. Yeah.
Okay. So mental health, you talked about that's a challenge, and it's a challenge nationally. We hear about that.
Yeah.
So there's a big shortage of mental health professionals.
Yes.
And I think in our rural states, that's particularly a challenge. How do you mitigate that challenge? What do you do?
Well, Currently, we have this new grant called Native Connections, and with this grant, we identified 10 people with their MSWs that still need to be licensed. So within the 5 years, we're working with these 10 people on getting their hours. I believe they have to do like 1,500 or maybe 3,000 hours.
Okay.
I'm not quite too sure, but just making sure that they get licensed within that time. And we're already working with these folks. So we'll have 10 licensed mental health specialists.
That is fantastic. And those 10 will serve your area,
Yeah.
in the Browning
Yeah.
area.
They're already there. They're already working within the schools in different areas, and they're working on getting their license, their hours. So,
What's new with tribal health programs? What's the latest thing?
I want to talk about our medicated assistant treatment program. We're excited to get that. With the high rate of babies being born drug affected, we were able to secure 3 grants to help get that put in place. So we're just very new with that. We'll be working with moms and their mates and helping them. Well, they'll be doing daily dosing, and then we'll do wraparound services with helping them to get them back on their feet. And so we were just very excited about that.
What an exciting new program.
Thank you.
Thank you so much. That was great information. Next, we're going to hear from an urban Indian center and how they provide a healthcare option for American Indians who don't necessarily live on tribal health lands. Stay with us.